Hey everybody, Dr. Tassone down here in southern Arizona, and I thought, well, I have a few minutes. Let's talk about estrogen again, and I feel like we need to talk about it because there is this still, and I don't know how long this is going to last, but there's this pervasive fear around the usage of estrogen, and I wanted to share with you the National Institutes of Health came out with an article in 2022 simply titled Menopausal Hormonal Therapy: Why We Should No Longer Be Afraid of the Breast Cancer Risk. And basically, what they're saying is that they understand that the breast cancer risk related to estrogen progesterone replacement, it's rare and the risk is extremely low, and that they feel like women, an entire generation of women, which I have also said, has been ruined because of this belief structure. And I'm going to tell you all of the things that I've heard women say that their doctors tell them, well, one, that it causes breast cancer, which it doesn't; that two, that it increases the risks of DVT or deep vein thrombosis, which it can, but that's usually related to estrogen replacement that's oral, not from topical estrogen. Thank you for bringing this to light. Of course, things that I've heard women say that their doctors told them. Um, they can't take it past 60. Absolutely no reason why not. If you look at one of my other videos on a study that came out, shows that women over the age of 65 that take estrogen replacement had decreased risks of breast, colon, and lung cancer. They also had decreased rates of dementia, and they lived longer. So that's not right. What I find is that doctors in general are afraid to prescribe estrogen. Um, I don't know why. I think it's ridiculous. I think that you're not going to change their mind, because women ask me all the time, how can I get my doctor to prescribe estrogen? And the simple answer is you can't. You need to find somebody that's willing to do it. Hello, hello. Such great news. Hey, from Australia. Why do some develop ocular migraines? I mean, hard to know. Migraines have so many triggers, right? Hard to know why somebody develops a migraine. Usually, when I see hormonally mediated migraines, it's because of the drop in progesterone in that second half of the cycle, which is an argument against using cyclical progesterone, in my opinion. But so I don't know why exactly women have those. Women with an aura should not be afraid of hormone replacement, because women with a migraine aura shouldn't use birth control. That's another concept that cracks me up, is that women are told all the time by these doctors that they can't use HRT because of the risk of breast cancer, but they were more than happy to prescribe years and years and years of oral contraceptive therapy, which has a much, much higher risk, which is not a real estrogen, which is about 7 times the strength of HRT, and just makes, again, absolutely no sense. How about hair loss in females? I have hair loss and have been taking saw palmetto. Saw palmetto is not going to do a whole lot. If you have hair loss and it's hormonally mediated, you're looking at three hormones for hair loss. Number one is low testosterone. Low testosterone will cause hair loss because the testosterone stimulates the hair follicle. You could have high testosterone. Super high testosterone from pellets and injections can convert into dihydrotestosterone, which can cause a male pattern type baldness. Low thyroid. Thyroid, just the same as testosterone, stimulates the hair follicle to grow. So a low hypothyroid state could cause you to lose hair. And then third, is progesterone. Have you ever noticed that when you're pregnant, your hair is like delicious, luscious, thick, and stable? That's because progesterone stops hair in a growth cycle where right before it falls out. And then what you've also noticed is after you deliver your baby, your hair all falls out. And that's because the hair that was supposed to fall out for those 6, 7, 8, 9 months, all of a sudden falls out. And so you're losing the hair that you normally would have lost. This is my first time on your great live. Oh, thanks. That's very nice of you. Hello from North Carolina. I used to get ocular migraines at work from stress. Yep. My last pellet expert gyno told me when I went into a spiral without the pellets, I couldn't even give you hormones or I would have to give you Xanax because you'd go crazy. That doesn't even make sense, right? I mean, you can look at my other YouTube videos. I hate pellets. Pellets are horrible. Pellets are a money grab. No doctor that is an expert in hormones would ever dream of giving pellets. Pellets are mediated by the industry that basically comes into a doctor's office and simply shows them how much money they would make. I'll be perfectly transparent. I did the numbers. If I did pellets with the number of patients that I have in my practice, I would make an extra $25,000 a month in revenue. And that just shows you that how much I hate pellets because I can't ethically, even though I would make that much more money, I ethically cannot bring myself to prescribe a pellet because I just think they're horrible. Yes, my hair grew like crazy when pregnant. Yep, yep. Hormone pellets. What are pellets? Pellets are these little pieces of rice looking things that contain testosterone, sometimes estrogen. They go under your skin and they're there for about 3 to 6 months. They cause your hormone levels to go way too high. Once you put them in, you can't get them out, and purely money grab. So let's get back to, you can keep asking questions. I'm just going to talk about estrogen. Let's think about this. If estrogen caused cancer, every woman in the world would get cancer because you all have estrogen, men too, for that matter. If estrogen caused cancer, wouldn't you expect then to see higher rates of breast cancer in women in their 20s because that's when your estrogen levels are probably at their highest, and we don't see that. We tend to see breast cancer cases in the 50s, 60s and 70s because cancer is more of an age-related, genetically related disease process. It's not necessarily hormonally caused. Now, if you have a breast cancer cell in your body and I give you estrogen and you have an estrogen receptor on that cell, I could stimulate the growth of that cell for sure. But that doesn't mean it's what caused it. Um, Even when I had ADHD medicine and had great focus, when I went off hormones, I needed a quick little cognitive decline. That's true. That can happen. Um, yeah, that pellet expert does sound uniquely stupid. So estrogen, the Women's Health Initiative that came out about 16 years ago that said there was an increased risk of breast cancer, that was only seen in the Prempro, Premarin and Provera group. The Premarin only arm, which was estrogen only, did not have an increased risk of breast cancer. That part of the study was never stopped and actually showed a 50% decrease in colon cancer rates. So the medication that the WHI caused a stir over was Prempro, which I haven't used in 20 years. I think it's still on the market, but I don't know why anybody would use it because it's made with horse urine and it's a horse estrogen, and the medroxyprogesterone that's in that is horrifying. So, bioidentical estrogen, bioidentical progesterone, and testosterone are, the safety is there. It's been shown in multiple studies. The goal also with hormone replacement should never be to make you superhuman. Like, we don't want your levels to be 5 times normal. We want to put you around the middle of normal or the lowest level possible to give you the best results. So, I have to keep looking because I didn't bring my glasses and I can't see. So, if you have any questions about estrogen or any other HRT, let me know. My reason for coming on here right now was that once again to just put the message out there that women don't need to be afraid of estradiol level. The National Institutes of Health, um, the article that recently came out in Menopause Magazine that said women over 65 lived longer. The other thing is, and I have a podcast episode on this, the North American Menopause Society, unfortunately, is still very rigid in the way that they recommend things are done. They will recommend bioidentical hormones, but they don't like compounded hormones. And I think another podcast, I talk about the differences between synthetics and bioidenticals. And I do think that bioidenticals are better. I do think that you can use bioidenticals either commercially available, like in patches and micronized progesterone, or you can have it compounded. Unfortunately, for women, the only way to get testosterone is to have it compounded. There are no FDA approved testosterone prescriptions for women. I think it's a damn shame. I think it shows the misogyny in the medical arena that says that women don't need testosterone when they actually do. Um, what level in Australian terms should estrogen be eliminated to do symptoms? On bioidentical testosterone, are ovaries required to increase production or without? Well, the ovaries make about 50% of your body's total testosterone. So when you go into menopause, you're going to lose about 50% of your testosterone production. So I also find that testosterone across the board is the hormone imbalance that's the most commonly seen across the board, all age groups, and most women suffer with it. Usually presents itself as fatigue. You want to take a nap around 3 or 4 in the afternoon, hair thinning for sure, decreased drive, motivation, desire, oomph, zest for living. And overall, you just feel kind of blah, kind of meh. So that's one of the main things with testosterone. Again, circling back, I'm just going to wrap this up real quick. You don't need to be afraid of estradiol. You don't need to be afraid of estrogen. The safety is out there. It's been shown multiple times. It's not the cause of breast cancer. Topical estrogens are uniquely safe, especially for women that might have increased risks of blood clots and things like that. Please find a provider that is willing to help you. You're not going to convince somebody to help you that doesn't believe in HRT. So don't waste your time with them. And you also don't need to spend $1 million to get HRT. You don't have to buy some year-long package for $8,000. My system is a la carte. You just pay as you go, and we'll get you happy. Last question. I don't have ovaries, just a teeny bit of testosterone is helpful, but I give Estratest. So Estratest is a horrible medication. Estratest is Premarin, which is the horse estrogen, combined with methyl testosterone. Now, methyl testosterone, that methyl part is horrible on your liver and isn't a safe way to do testosterone. You want to use bioidentical testosterone, not methyl testosterone. So I wouldn't put anybody on Estratest. Oh, good. Nice to meet you then. So that being said, I'm going to wrap it up. Stay tuned. I'm going to probably go live again this weekend. Keep the questions coming. You can follow me on Instagram. I do question and answers on Saturdays. And also, obviously, if you're really interested in hormones and you want to read, you can go to Amazon and get a copy of my book, The Hormone Balance Bible, where I talk about the 12 most common hormone imbalances. It's 500 pages of all the stuff you ever wanted to know about hormone replacement. Thanks for watching and have a great weekend.